Good day, I'm Stephen McHugh, and this is your JIS News for Wednesday, November 18. The Planning Institute of Jamaica, PIOJ, is reporting a 2% increase in agricultural output for the July to September quarter. Director General Dr. Wayne Henry provided the update at the agency's press briefing earlier today.
Other agricultural crops was estimated to have grown by 8.4%, reflecting higher production in 8 of the 9 crop groups. The most significant increases were recorded for fruits, up 28.3%, condiments, up 22.3%, other tubers, up 21.3%, cereals, up 17.2%, and vegetables, up 15.3%.
Dr. Henry says while recent rains have impacted the sector, it will only be short-term. Overall, for the July to September quarter, there was economic decline of 11.3%. PIOJ's Director General says this was exacerbated by the increase in local COVID-19 cases and initiatives used to manage the spread. But he says the phased reopening of the economy is expected to slow the pace of decline. The PIOJ is projecting that gross domestic product will recover within 3 to 4 years and the labor market within 2 to 3 years.
Strategic priority actions of the government therefore include an increased focus on public investment with the assistance of our development partners to spur economic activities as we work together to build forward stronger.
The Ministry of Health and Wellness has launched a $100 million public-private partnership program for the control of non-communicable diseases. The initiative will allow 5,000 non-COVID-19 patients from select health centers to access care from private physicians. Persons with diabetes and hypertension will be targeted in the first phase, with an additional 1,000 persons being added to the program. 4 doctors have been selected to work with 8 health centers in Clarendon, St. Anne, Kingston, and St. Andrew. In a statement to Parliament Tuesday following the launch, Health and Wellness Minister Dr. Christopher Tufton said patients would be allowed 4 routine care visits and 2 ad hoc visits annually.
Patients will have no out-of-pocket expenses, Madam Speaker, very importantly. So this is a cost to the government, not to the patient. And Madam Speaker, the patients will still have access to the NHF Drug Serve, and NHF will engage and manage the relationship with these private practitioners. So they will get to see the private practitioner, no cost to them, that is negotiated by government, and they will be able to go to the Drug Serve window and continue to get their medication at no cost. Additionally, patients will still be able to access diagnostic or monitoring tests free of cost.
In other news, delinquent dog owners could soon face civil and criminal liabilities after the House of Representatives yesterday passed the New Dogs Liability for Attacks Act 2020. Justice Minister Delroy Chuck, who tabled the bill, said that under the proposed law, dog owners found liable may pay fines of up to $3 million. They may also face imprisonment of up to 15 years where they fail to pay the fine.
What this means, Madam Chairman, as I said in the debate, is that these offenses are not meant to impose or to have offenders having a criminal record. These are really deterrent quasi-criminal offenses. So what this subsection does is to ensure that in the parish courts, the persons who are fined do not have a criminal record.
The bill, which was passed yesterday with 17 amendments, will now go before the Senate for its approval. Under the law, civil liability can also be incurred if the dog causes injury in any place other than its home or where it is normally kept. Still in Parliament Tuesday, the 17 institutions selected for the pilot Face-to-Face in School project have returned a satisfactory grade. That's according to Minister of Education, Youth and Information, Fable Williams, who was addressing the House of Representatives.
The entry points were reported as adequately staffed and efficiently operated. The overall management in the classroom space was found to be satisfactorily done by the observers in the schools they visited. The administrators of the schools added print-rich signs to the school's plans to remind students to wear masks, sanitize, and wash hands regularly. Transition from class to class and subject to subject were managed efficiently by teachers.
The 12 primary and 5 secondary schools are currently on the last leg of the 2-week pilot initiative. Minister Williams says reports were gathered by independent data collectors and officers from the ministry who visited the schools during the week to observe the activities and to provide feedback on 6 criteria areas. The minister says the data collected has been shared with principals and members of the e-COVID task force, which will inform a way forward. She says a more comprehensive update will be provided after November 20 when the pilot ends. In the meantime, members of Parliament are now in receipt of 250 applications under the Ministry of Education's Own Your Own Device OYOD incentive program. The initiative will see 36,000 primary and secondary needy students who are not on the Program of Advancement through Health and Education PATH getting a $20,000 voucher to purchase an e-learning device. In addition to applications being accessed through the OYOD website, parents and guardians may retrieve application forms from their parliamentarians and the ministry's regional offices.
All areas of the forms must be completed. Forms must not be copied or reprinted. If that is done, it will be rejected. The information on the application form must be uploaded on the oyod.educate.gov.jm website before December 4, 2020 for verification.
Persons unable to upload registration forms may return them to the Ministry of Education's head office at 2-4 National Hero Circle, Building 1, Kingston 4. Queries on this program can be made by calling 888-696-3669 weekdays between the hours of 9 a.m. and 4 p.m. or by emailing oyod@moey.gov.jm. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.